Good evening. This is Dr. Dolopo, and I'm a doctor of acupuncture and Chinese medicine. This is my 25th year in practice, and I'm also board certified and a licensed acupuncturist. And no, I'm not sick. I just used my voice a lot yesterday teaching a deliberate creation class and a Qigong class, and had a lot of fun the rest of the day. So let me know when the next Qigong class you'd like to have. In March, I teach at the beach once a month. Today, I want to talk about a 90-year-old woman. She just turned 90 years young last Friday. I'm so proud of her. My job was to get her from barely walking with a cane. She could barely make it from the front door to the table. There's a ADA parking space right in front of my office. It was very hard for her to walk in through the door, and she needed her cane to walk. This woman rides a beautiful Arabian horse. My job was to make that happen again. So we did it. Today she's 95% better. I would say after 5 or so treatments, she was already back on her horse. She came to see me February 8, 9, 11, 12, 13, 14, 15, 17, and 19. So that's 9 treatments from February 8. So February 8, 9, 2 days straight. February 11, 12, 13, 14, 15. 11, 12, 13, 14, 15, 5 days straight. And then February 17 and 19. And she sent me a beautiful picture of her on her horse. No less than 3 or 4 treatments, but definitely by the 5th treatment, she was back on her horse, riding her horse. And that's very important to her. What I want to share most is she's not done. We'll see what happens the next week because she'll be going to her to a horse show in the next week, and we'll see how long the treatment lasts. We are on the path to graduating from pain. This woman is a retired registered nurse, a retired nurse practitioner, and much of her family has been or had been in Western medicine. What I really want to share is how determined this young 90-year-old, how young the attitude is of this 90-year-old woman. She had this determination to heal, to literally get back on her horse and have her life again. She walked in today without her cane. Yesterday, 2 days ago when she came in, she walked in barely using her cane. And I think either that day or on the 15th, she came in with her cane and she forgot it at the table. I had to bring it to her. So if you are suffering from sciatic pain, hip pain, consider seeing me. And the more aggressive you can be, the better. I did a video called Expectations. Go to elementsinharmonyacupuncture.com/expectations. The reason why this woman knows how aggressive, how frequent to be with her treatments is because we did take care of a particular issue last year in 2013. So again, today was her 9th treatment. After only 8 treatments, she was already at 95% better. And this is what I mean with Balance Method Acupuncture. None of the needles go to her hip. None of the needles go to her sciatic area. None of the needles go to the low back. They're all elsewhere in her limbs, her hands, her arms, her elbows, her knees, her ankles. They're everywhere else but the location of pain. So if you go to elementsinharmonyacupuncture.com, you'll see several areas, little sections. You'll see one section just for pain testimonials. And so if a person says that they graduated from neck pain, none of the needles went to the neck. I define it as if a person has neck pain, or it could be for anything else. It could be for digestive issues, cardiovascular issues. I'm treating someone right now who has done everything she could in this Western medical route for heart failure. I treated something years ago, and she's come back and she's already feeling significantly better after less than 5 treatments. After the first treatment, she was already much better, and she knows to be here almost every day or to be here every day. So I'm going to be revisiting some of my more challenging class cases, my brain hemorrhage with migraines. Check that out. If you can't find these cases, which you can just go to the search area at elementsinharmonyacupuncture.com, look up brain hemorrhage, stage 4 kidney disease. That's not the only stage 4 kidney disease case that I've ever treated. very challenging digestive issues, severe, musculoskeletal issues, nerve pain, and I'm treating this gentleman who is, I want to say 74 years old, 74 years young, and he had 3 surgeries for his hands for numbness and neuropathy in his tingling in his fingers, and the doctors were like, well, let's do another surgery. He's like, you're not cutting me open anymore, you're not going to do any more surgery. And he's already feeling improvement. He said it's less tingly. First of all, the pain that he had in his wrist and his hand is gone. It's been gone for several treatments now. I'll do a proper video for that with the dates, but the pain's gone, the tingling is much improved. And he said he's starting to feel, well, the tingling is at least 30 to 40% better, at least. And he can feel sensation in his fingers. And he's here consistently, at least twice a week. So if you go once a week, just be very patient. Twice a week is better. If you're here 3 or more times a week, we could really get magic happen. And that's what happened with this 90-year-old woman. All right, so if you have any pain, come check me out. We will heal you. I have a team of acupuncturists here, and we also do massage, fire cupping, and moxibustion, cosmetic acupuncture. Whatever it is that you need regarding Chinese medicine, we more than likely can help you 6 to 7 days a week. The name of our website is elementsinharmonyacupuncture.com. Thanks for sharing this video, and please subscribe. Take care.